Hello, and welcome to McGill Cares webcast series supporting family and informal caregivers. I'm Claire Webster, a former caregiver, certified Alzheimer care consultant, and founder of the McGill University Dementia Education Program. I work with a dynamic team of leading healthcare professionals to oversee this program, who include Dr. José Moret from the Division of Geriatric Medicine, Dr. Serge Gauthier, McGill University Research Center for Studies in Aging, and Dr. Gerald Freed, McGill Steinberg Center for Simulation and Interactive Learning. These webcasts are made possible thanks to the generosity of our donors, and today's webcast is made possible by Ryan and Dominique Lyman in memory of their wonderful nanas, Stella Pearson and Muriel Wilson. So today's topic is language and communication with persons living with dementia. My guest is Noémie Auclair-Ouellet, speech-language pathologist and professor at the School of Communication Sciences and Disorders at the McGill Faculty of Medicine and Health Sciences. Dr. Auclair-Ouellet leads the Communication Strategic Group from the Quebec Rehabilitation Research Network. She works with people living with mild cognitive impairment and dementia, as well as those with aphasia following a stroke. Her research focuses on the interaction between language, other domains of cognition, and the global clinical profile in aphasia, dementia, and Parkinson's disease. Welcome to McGill Cares.
Thanks for having me.
So I think we'd like to begin by perhaps you providing an explanation of how does dementia impact people's communication and language skills?
Yeah, so in terms of the changes that happen in the brain, we know in dementia it can be pretty diffuse, so it can impact many different brain regions. And as we get a better understanding of language and communication, we start to understand how important the whole brain is. So in the past, we used to think that there were two very important regions, Broca's area, Wernicke's area, that were the main ones that were important for language, located in the left hemisphere of the brain. But as we get more knowledge from neuroimaging research and also from research on the communication of people with dementia, we understand that there are a lot of brain regions that are involved in language and communication. And it's not necessarily the regions themselves, but how they are connected with each other. That is really, really important. So we have a better understanding also of how the information goes from one place to another in the brain, and how that can be impacted by dementia. So there can be changes to the white matter that will make it more difficult from that information to go from one region to the next. And there can be changes to the gray matter, so the parts of the brain that actually process the information. So that's for more of the anatomical reasons that explain why you might see some changes in dementia.
So what types of communication changes happen? Like what will we see? I mean, I'll using my mom as an example, at the beginning, she had trouble finding words, just everyday common words she had difficulty from the very beginning. So what changes would we expect?
Yes, so for example, in dementia, finding words is very common. And as you said, it will happen early and it can affect words that are pretty common or everyday words. So that is one thing that we can see, for example, in Alzheimer's disease. In other types of dementia, it might also impact things that are more related to voice or to articulation. So being able to pronounce words clearly or being able to speak with a loud enough voice, that can also happen in dementias, but also in neurological disorders that we think of more as movement disorders, like Parkinson's, for example. So we know that Parkinson's, there's also some cognitive changes that can lead to word finding difficulties and broader communication difficulties. But it's going to look different in different dementias. But probably the common point is that language and communication is a complex mental activity, so a complex cognitive activity. So it's common that in many, many dementias, it's going to be impacted.
So there are also impacts in terms of really, like, for instance, reading. So, a lot of families that I work with, will leave Post-it notes around the house or, little notes. And as time goes on, the person sees the words, but they don't understand what is written. Like they're not able to process the information. So can you explain that concept?
Yes. So there's first recognizing what the word is. So the label, the written letters, that can become difficult. But then even if you do recognize that it's a real word that you're familiar with, you might not be able to connect it with the concept that it's supposed to represent.
Mm-hmm.
So you might just stay with this kind of label, so you know it should sound like this, but you're not able to connect the concept behind it. So that's more what we call the semantics.
Mm-hmm.
So understanding, for example, if it's a tool or if it's an object, an animal. So it might be harder to make the connection between just a word and what it's supposed to mean.
So this is a big problem because at the beginning of all, in the earlier stages, people that are still trying to manage their finances and pay bills, this is where we're seeing a lot of errors, right? So they get invoices or they get bills, and they're able to see the words, but they don't necessarily process, and this is when errors are happening.
Absolutely. And managing finances, it also involves numbers, and that sometimes can be impacted in different ways than understanding words is going to be. So we do see more and more research being done on that. It's an area in Europe, speech-language pathologists work more on this, managing finances, understanding numbers, being able to write numbers correctly too. So if you're writing a check, it's really important to be able to write the correct number. And there are tools that are being developed to sort of assess capacity to manage finances, because people are starting to understand that just a basic cognitive evaluation or something that is more of a screening, it's not going to tell you good information on is a person able to manage their finances.
So this becomes very complex because their writing skills are changing, their understanding skills are changing, but then the whole sense of logic is changing. So to be able to, for instance, people that are still managing emails or then getting solicitation phone calls are not able to process and logically think this is correct, or maybe I'm going to make mistakes, right? Like it's the whole package that's being affected.
Absolutely. And yeah, as you said, reasoning is very important. And if that can make a person vulnerable, unfortunately, right? So we do see those stories of scams and all kinds of hoax that are circulating. So it's really important to be vigilant, probably, and to help people flag things that seem abnormal or things that don't seem quite right. So that's very, very important. For sure.
So what happens when somebody speaks more than one language? Like in my mom's case, she spoke Finnish. Like, I mean, do they start intertwining the languages? Like, what will we start to notice?
Yeah, so it can happen that a person might start adding some words from the other language. So say, for example, speaking English, but adding a few words of Finnish in between. And the words that are very similar between languages are more vulnerable to that. So if we think of French and English, like family, famille could be words that are that could lead a person to make some slips between languages. So that can happen. And we know, for example, the oldest memories tend to be more preserved. And that could also, in some ways, apply to language. So a language that a person has learned early in life as a child might be stronger or more robust to change. So that might be preserved the longest. And another thing that may happen too is, say your mother probably didn't speak Finnish to you, and it was clear to her that you were not a Finnish speaker, but maybe over time that became a bit unclear, or maybe she thought for some reason that you might be able to understand Finnish, so she might have used more Finnish words with you, thinking that you shared this language together.
Which unfortunately I didn't, so I wasn't able to understand, what she was saying to me as time went on. Yeah. How do communications change? The communication change depending on the form of dementia a person has. So, is it different according to the dementia?
Yeah, so it's going to be very different. For some dementias, it will happen later on, or it will become a more important problem later on in the disease, whereas in some other kinds of dementia, that will be the first thing that people notice. And that will be the major difficulty for a long time before they develop more different cognitive difficulties. So that can be the first problem in terms of timing and also in terms of importance. And also the different types of difficulties. So as we said, communication is very broad. It can be your voice, your articulation, it can be your word finding, and it can also be things like making complete sentences with the words in the right order, not skipping words like the, in, to. That can also be a difficulty for some people.
Why do people forget like the names of people more than other words? Like, why is it so hard to remember people's names?
So if you think of a person's name, it can be pretty arbitrary, right? So I can know many Claires and they don't all look alike. I don't know them in the same context. I don't know them for the same reason. So the name of a person is really different from one person to the next. So all the Claires that I know don't all look alike. So it's really something that is very unique. Whereas if you think of, for example, an apple, pretty much all apples that you see will be relatively similar in shape and color and things like that. So the name of people is something that is very unique. And that's why we think that because it's not supported by many different examples that are pretty alike, that becomes more vulnerable to maintain that specific information about a person over time.
Okay. You mentioned earlier too, you're just prompting me to think about a question. You mentioned earlier, and we say, so people retain, past memories, like where they were born, some memories from the past, okay? But it's all this new information that the brain cannot retain. But why is it also, why can they retain like their history, the past, but not the present?
Yeah, that's a good question. So it's really more about memory than about language and communication. But of course, words are also we have a memory, right? So remembering things and events is going to be a bit different than remembering words, remembering concepts. But there's definitely an overlap between those things. And why people are not able to remember new information, yeah, that is a good question. That is really the core of the difficulties, right? So that's probably the main problem and the thing that appears the earliest. And in our intervention, so if we're trying to help people maintain some communication or regain some communication, that's going to be a challenge too, right? So to help them learn new techniques or new strategies, we need to find good ways to support them and maybe involve people around the person with dementia a bit more so that they're able to provide that kind of support.
So can you explain primary progressive aphasia and how is it different from Alzheimer's disease?
Yes. So primary progressive aphasia, it's a name for 3 different types of dementia. So there's the semantic variant of primary progressive aphasia. It's also known as semantic dementia sometimes. There's the non-fluent agrammatic primary progressive aphasia. And there's a logopenic variant, primary progressive aphasia. And the 2 first ones are closer to frontotemporal dementia in terms of the brain pathology. So the changes that we see in the brain, whereas the logopenic variant is closer to Alzheimer's disease. So the changes, the pathology in the brain cells is quite similar to Alzheimer's, but the symptoms are different. So instead of having memory problems first, people with the logopenic variant, they tend to have problems with articulating words or speaking fluently. So speaking becomes a bit more labored. They have a hard time repeating words. So it's the kind of the telltale sign when a person has a harder time repeating words. That's one of the first signs for the logopenic variant. The semantic variant, it's more understanding concepts, finding the right words, and that will extend to everyday objects as well. So knowing what an object is used for, how you use it, with what other objects you use it, that becomes more difficult. And the non-fluent agrammatic variant, the problems are more related to articulation, so speaking clearly, and understanding sentences that are more complex, or putting the words in the right order when you're making a sentence.
So let's talk a bit about the evolution. So from the moment that somebody receives a diagnosis of dementia or a primary progressive aphasia, along the journey, what happens to the language skills? Do they, by the end, I mean, I've seen it myself, and perhaps you can explain it, basically the language skills completely disappear.
Yeah, so in the final stages, the language skills may be, as you said, it might completely disappear. So the person may be mute, not speak at all. They might also have different difficulty understanding that are very severe. But what remains until maybe the very end is the connection to another person, maybe more in an emotional sense or a social connection. And in the very, very broad sense, we could see that as communication still. So that part is probably what remains until the very end. But yeah, you are right that as the disease progresses, we may see more and more severe difficulties. And some people might have good plateaus, so periods where they are more stable with, at some point, a steeper decline. But it really varies from one person to the next.
So, unfortunately now with the pandemic, more and more people are at home. You've got, the care partner who's, caring for their loved one who has dementia. Let's talk about best practices, like strategies to, communicate with somebody. What type of interventions are available? What can people do right now?
Yeah, so it can be, some people will want, for example, to help their loved one relearn words, and put a lot of energy in drilling or in showing pictures and asking a person to name words. So we know we can do that. We have some success with that. But it's important to choose words that are going to be very, very useful, and maybe a small number of words. And we need to keep in mind that the person will eventually forget those words. So we know that the progression is going towards a decline. So what people tend to do more nowadays is either select words that the person really wants to keep as long as possible, instead of trying to make them relearn words. And maybe an even better approach, especially now with the pandemic, is being supportive in communication. So when you're having a conversation, try to ask questions about the person's interest, what they have done, and avoid those more quizzing or testing questions about, do you remember this? Do you remember that? Did you see that person the other day? So really questions that go more into having a real exchange of information, a real interaction.
What you just said is really important, because there are triggers. A lot of times, the person with dementia will get very, very frustrated or get upset. And it's really because the family member keeps saying to them, don't you remember? I just told you. Why can't you remember? And I think what's important for people to understand is the disease makes it so that the person cannot remember. They're not doing it on purpose. They're not asking the same question over and over on purpose. It's just that they're not able to, right?
Exactly. Yeah. That's a very good point, and super important to understand. So the person is not being difficult on purpose and just not trying to remember. It's really part of the disease.
And so then what about also, the speed at which we speak to somebody, or to be standing in front of them? I remember with my mom, if I was in another room and tried to talk to her, she was, looking around, like not knowing where that sound was coming from. What about with regards to our body language and how we position ourselves?
Yeah, so that's a very good point. So if you're able to stand straight in front of the person, that they're able to see your face. So we get a lot of cues from our mouth movement, which leads me to talk about masks. So We know it's been a difficulty for a lot of people with communication disorders, aphasia following stroke, people who are deaf or hard of hearing. The mask has been a challenge for them. So yeah, something to keep in mind. In ideal circumstances, if people are able to see your mouth movement, it's going to help them. I'm also thinking of Zooms. So having good lighting is important if as much as possible. And if you're in person, if you're directly in the same room, yeah, so if you're able to stay close, to be directly in front of the person, and to make sure that there's not a lot of distraction, not a lot of movement going on around you. Sometimes also it's going to be difficult to have a conversation with more than one person at a time. Mm-hmm. So maybe manage that, or make it easier if you know that there's going to be more than one person around, so that it's calm and that there's not a lot of noise or a lot of movement.
Like a lot of like the TV being on in the background, mm-hmm. or the radio playing, or multiple things. I mean, I often got questions from family members about how, you know, before the pandemic, when there would be family gatherings, for example, and then all of a sudden the loved one would just get up and leave the table, or, you know, my mom would do this, like she would put her hands. And what I realized is there was just too much conversation, too much noise, all these people trying to talk to her at once. She couldn't process, right? Like that could become very disturbing for a person with dementia, right?
Yeah. So yeah, you exactly, it can become disturbing and lead the person to isolate, right? And that's something we don't want. So we want the people to stay engaged as much as possible and the longest that we can. So trying to make those situations in which we communicate easiest as we can, and by limiting the noise, as you said, and also being mindful of large groups being more difficult, that can definitely help.
So what could families do to best really support a loved one with dementia? I mean, I know, again, I want to talk about, you know, everybody feels like they're under house arrest and it's frustrating, but people are losing patience. You know, how could, you know, care partners best support their loved one, but also best support themselves?
Yeah. So I think one very important point, as you said, is understanding that the person is not doing that on purpose, and understanding that they still have important things to say and they still have feelings to share, and that the connection, the social and the emotional connection, is really what is the most important. So even if the person doesn't always say the right word, or if it doesn't come out as clearly as it did, or if they use a workaround, you know, if they say the thing to look at the weather or to look at the temperature instead of the thermometer, to accept that as being good and as being valuable, and as, you know, conveying the message and the information that the person is trying to get across. So that's probably the first important thing. And to think of communication as something that is really broad. So you can use gestures, you can use sometimes a drawing if it's not clear with words, to try to support what you're saying. And visuals are going to be very helpful. So if you have pictures that you can use to try to say, well, here's what we are talking about right now, and to make sure that you're both on the same page, that can be very helpful.
You know, one thing I've learned, and I keep repeating over and over to people that I work with, it's really about sometimes, you know, like pick your battles and join their journey. You know, especially I find as their communication skills begin to decline, you know, they're doing their best, they want to participate, but sometimes they could start telling stories that perhaps don't make any sense. But, you know, I say, you know, because we're so confined, it's like pick your battles. If what they're saying is not hurting themselves and is not hurting you, just let it go, let them speak, join their journey, stop trying to correct them. Because what I do when I oftentimes when I work with couples is that the spouse is always so frustrated and they start arguing and saying, no, it's not true, but it's just going to escalate, right? So by joining the journey and, you know, just let them speak and don't correct them, it'll probably help, you know, deflate some of those arguments that would happen.
Yeah, absolutely. So as you're saying, if they're not hurting themselves and if it's not like an urgent matter, in the here and now, then yeah, you can definitely let them speak and, you know, be there for them in that moment.
So can you talk a bit about the role of a speech-language pathologist and any, you know, important resources that you could maybe recommend to our viewers?
Yeah, so I know that speech-language pathologists, we always think of them working with children, mostly in schools, but we also work in hospitals and rehabilitation centers, and work with people who have dementia is a newer area for us in our practice, but there are services that are being developed. So there's also more training happening in the school. So the new speech language pathologists that are graduating are better trained now to work with people who have dementia. So that's a big step. And the services, well, it's always a bit longer for that to come along. But rehabilitation centers now, they try to offer more services, but it's still very variable from one region to the next or from one center to the next. So there are community resources that first started of resources for people with aphasia following a stroke. So I'm thinking, for example, of AQPA or Association Québécoise des Personnes Aphasiques. They are starting groups and services for people with dementia and caregivers. So it's more
online, or are there any virtual?
I guess they have made the move online. So I would think they have done that. I know they've done that for people with aphasia. So I think for people with dementia, probably they have done that too. But yeah, so we have a better understanding now. At first, we were mixing people with dementia with people who had aphasia following a stroke. And it's not because people have communication difficulties, that their experience and the general context is the same. So now we do understand that we need something that is really for people with dementia and their caregivers. So this is something that is being developed now, but it's kind of new. But I would really encourage people to check out AQPA as a resource.
And what about just at home, for instance, you know, going through old picture books, or, you know, is there things that people could do, you know, just to practice, you know, keep those language skills going? Is there anything that you could recommend?
Yeah, so one thing that can be useful is to have a memory box. So to have pictures and objects that were relevant to the person in their life. And you can use that as a conversation starter, just to be engaged in the moment together. And yeah, to either talk about a memory or just something that they enjoyed doing. Yeah, to have this kind of connection. And the visuals and the objects are going to be very, very helpful.
So we have a really also excellent resource on our website at mcgill.ca/dementia, which is the dementia activity booklet that was made by students from the McGill School of Physical and Occupational Therapy, that could be downloaded for free, has all kinds of activities that people could do at home. I really encourage people to go and download it, because they're, you know, it's really about right now, it's this whole, as everyone says, that we feel like we're all under house arrest. But, you know, keeping ourselves cognitively stimulated as well as physically stimulated.
Absolutely. And I think, yeah, the connection between the two people, the interaction, it can use words if people are still able to do that. But if it's just, you know, working with small objects, drawings, even if it's not verbal communication, that's still an interaction, and that's still a connection between two people. So that's very important.
Noémie, thank you very, very much for being on McGill Cares with me today.
Well, thank you so much for having me.
Please join me on Wednesday, February 17th for a special episode of McGill Cares in honor of Heart Month. And we're going to be celebrating a lifetime of heart resilience. I will be joined by Dr. Jacqueline Joza, cardiac electrophysiologist and assistant professor of medicine at McGill University Health Center, to commemorate the 1-year anniversary of my 6th pacemaker surgery. I said 6, yes, which took place on February 6th. And I will be sharing my story and with Dr. Joza. So this webcast is an initiative of the McGill Dementia Education Program, which is funded by private donations. Once again, I would like to thank Dominic and Ryan Lyman for sponsoring today's webcast. If you would like to make a contribution or for more information, please visit us at mcgill.ca/dementia. And if you have specific topics or questions that you would like us to address, please email us at dementia@mcgill.ca. Thank you for watching.